Well, during pregnancy, muscle weakness may worsen. Actually, that occurs in a fair proportion of the women with myotonic dystrophy, with muscular dystrophies like FSHD and limb-girdle muscular dystrophy, but also in other neuromuscular diseases like Charcot-Marie-Tooth disease and spinal muscular atrophy. Sometimes there's improvement of muscle weakness after delivery, but in most cases, this deterioration is permanent. However, it is reassuring to know that most women who were walking before they got pregnant remain ambulant. Sometimes pregnancy reveals that someone is suffering from a neuromuscular disease which had gone unnoticed previously. And a well-known example is myotonic dystrophy, one of the most frequent neuromuscular diseases. It does occur rather frequently that if a severely weak child is born who is found to have congenital myotonic dystrophy, only then the diagnosis myotonic dystrophy is established in the mother. Well, first, I should like to stress that serious neuromuscular complications during pregnancy are rare. I think that's an important take-home message. And we have to realize that, unfortunately, not much research has been done on this topic. The knowledge we have is mostly from anecdotal cases or from small cohorts of patients. However, we do know quite a lot about the implications in a well-known and relatively frequent disease, myotonic dystrophy, as I mentioned before. These women run the risk of preeclampsia, which causes very high blood pressure during pregnancy. Other complications include placenta previa, causing severe bleeding at delivery, preterm labor and delivery, but there may also be complications after delivery, such as hemorrhage, since the uterus has difficulty to contract and stop the bleeding. And your question about medication is a very important issue. Usually patients with hereditary neuromuscular disease do not have medication for their disease because by far the majority can as yet not be cured. However, that is different in neuromuscular diseases which are so-called acquired and immune-mediated, the autoimmune diseases like myositis and myasthenia gravis. If these women are treated with prednisone or azathioprine, they do not have to worry and can keep on using these medications during pregnancy, but also if they breastfeed. There is ample evidence that these drugs are safe. Actually, a general recommendation is that pregnant women with a neuromuscular disease need to be under the care of a multidisciplinary team. As I said before, I would recommend to consult a neuromuscular expert in a specialty center before they plan a pregnancy. If a woman with a neuromuscular disease is not known in such a center, they should ask the GPs for a referral. If the woman is suffering from a hereditary neuromuscular disease, genetic counseling is crucial. Geneticists can counsel her about the risk that she will give birth to a child with the same disease, and options like prenatal diagnosis or pre-implantation genetic diagnosis that is dependent on cultural differences, of course, should also be discussed. The neuromuscular expert should discuss the possible influence of the disease on the woman's neuromuscular condition and the risk during pregnancy and labor, and should monitor her on a regular basis. My main recommendation would be aware of the possible risks. And awareness means that doctors like obstetricians should monitor the pregnant patients carefully and consult a neuromuscular expert to obtain information about possible risks during pregnancy and labor. But also be aware that newborns need to be closely looked after. For example, in myasthenia gravis, they may develop myasthenia themselves, as a result of transmission of antibodies via the mother. And a special word of caution for these women who have a reduced lung function due to muscle weakness or heart involvement, which often occurs in hereditary muscle diseases. They should indeed be closely monitored, especially during the third trimester, because that period has the highest risk of cardiac complications. Well, I already mentioned that there is only sparse information in the literature on pregnancy-related issues in women suffering from neuromuscular diseases. Firstly, there is a need for more research. And secondly, as I said, there needs to be more awareness amongst patients with a neuromuscular disease, but also amongst their treating physicians. And that requires education of the patients who want to start a family and also of their treating physicians.